You're all good to go.
Okay. Can you all see this? Yes, perfect.
Yes.
Okay. So today I'm going to talk about attachment and abnormal attachment. So naturally, when talking about abnormal attachment, we have to start with attachment. So we'll start from the very beginning. And for those of you who have seen me present before, and many of you on here have seen me present this, so this is my favorite definition of attachment, that deep, enduring emotional bond that connects a person to another across time and space. And this is one of my favorites because it's ongoing, right? And so it's like bilateral, it just keeps going and then it comes back. And that's how attachment is. And a lot of the times, I mean, we know that those first 3 years are so critical for attachment, but it doesn't mean that an attachment didn't occur, or if an unhealthy attachment occurred, that we can't attach after that, because you can build attachment. It's harder and it's complicated, but you can. So let's think about it. So I want you guys to think about, you're invited to a baby shower. You find out the registry, you go online, you're scrolling through to see what you're going to get. What are you guys going to get? Anybody have any go-to items for your baby showers?
Swaddling blankets.
Swaddling blankets. Yeah. What
Oh,
else?
Cheryl nailed it.
Also diapers. Yep.
Diapers. I'm always about diapers.
Yes, me too. Listen, I know, and both of my kids are older, but like when you play those games where they bring in diapers for extra whatever, tickets or winning whatever, those diapers lasted me for like 4 months. I was so grateful. Yeah, so anything else? Anything else you guys think of that your go-tos are? It's so interesting when you're looking at registries too, because go ahead, Colleen, were you going to say something?
So I will say the difference, I think, if it's a girl, a lot of people tend to buy clothes, but if it's a boy, they tend to buy really practical things. As a mom of both, that was my experience. Done.
So yeah, I think that's a really good point, right? So you start to identify culturally what's going to help this child grow, and what they're going to wear and what they're going to look like. And so you can start to see what some cultural beliefs are too, right? As people put in their registry, and some people will use some things and some people will absolutely not. And so you start to kind of identify that. And it's really important because this is an important piece. This is like a ritual. This is a ritual and a routine that a lot of people have. They have baby showers, and sometimes our own cultural beliefs come into play. Like I know some people that are like, and it seems like an older generation too, they're like, I'm not even looking at the registry. This is what I'm getting. This is what I'll get. This is what they need, right? And so they kind of identify that within themselves. And then it can even cause the person having the baby to think about, is that something I need? But the reality is that things are not the most important things. So the most important things are not things. So what is it? It's relationships, right? And a baby shower kind of starts developing that relationship. So this ritual that occurs, a mother starts to think about, I mean, if you think about a registry and signing up for all of those items, yeah, it can be kind of fun, but parents start to identify what it is that they're going to need to take care of their kids, what it is they're going to need to help their kids grow, survive, be healthy. And so that automatically starts an attachment piece. That's that reorganization that starts to occur. So they're moving from being an individual to being a parent now, and this is what's needed. And so that prenatal attachment starts to kind of organize them. And this is kind of the reorganization chart, right? You're moving from an individual, someone's child, you've been someone's child, to a wife, a partner, possible working person, and now a mother. And so you have to reorganize kind of all these thoughts, and a lot of different things throughout pregnancy can help you start this reorganization and this prenatal attachment. So it's really important. Prenatal attachment is definitely beneficial. We know that attachment that occurs prenatally is linked to postnatal positive development, and negative associations with prenatal attachment can lead to signs and symptoms of anxiety and depression, not only in mothers, but also in infants. And so we know that that has a huge impact. Prenatal attachment helps mothers become more in tune with the rhythms of the baby, right? And this reduces baby's need as they're developed. And so there's a lot of studies that kind of support that. They're super interesting. Object relationship takes place, and this takes place prenatally in about the second trimester. This is when the mother starts to really identify that there is an object within her. They start to identify that there's something there. They can start to feel the baby move a little more too, so that helps the situation. But then they start to reflect on their own parenting, and we've talked about this in the sense of intergenerational trauma. So sometimes that can be a positive experience. Sometimes that could have been a negative experience. And when it's a negative experience, sometimes it can surface some of that intergenerational trauma, but they really start to build and determine their maternal identity. So what kind of mother they're going to be like, how they're going to protect their child, how they're going to take care of their child. And so sometimes when they've not had great experiences, they can start to really have some ambivalence around this and their capabilities and ability to do that. We know that toxic exposure can impact a child in utero. It can impact their capacity to manage stress and their stress levels to regulate. And so we see a lot of kids that are exposed to toxic stress have a very difficult time regulating. It can impact their cognitive capacities as well as their developmental milestones. So sometimes we see this even early on. I do a newborn behavior observation. And I think many of you were, I think the PBS was involved in some of that training. So some of you might have actually been trained in the newborn behavior observation by T. Barry Brazelton. And this is such an interesting observation. And I do it with our moms who've been exposed to substance use disorder. And it's super interesting to see some of these babies and the struggles that they're having in their development right away, right within 3 days. I mean, the observation happens within the first 3 months, and sometimes we can see some of this underdevelopment just within 3 days, and so and sooner at times. So it's really interesting. So knowing this, right, knowing some of that exposure, how do you think that would contribute to abnormal attachment? Any guesses? Oh, I just saw Jackie's baby shower gift, a massage gift certificate. That's like so great. All right.
Jackie, I should have invited you to my pretend baby shower this time. If I had only known. I was going to say, I wondered if there could be any influence with the toxic stress and temperament of the child. And if the child has a more difficult temperament, then I imagine that increases mom's stress. The baby's crying a lot, just could influence the relationship.
Yes. Did you look at my PowerPoint?
So I did not. I just have been a mom and
you know, you live it.
The temperament. They all have different temperament.
Absolutely. They do have different temperaments, and temperament has so many components that impact it. They have genetic components, they have environmental components, right? Regulation components. So their temperament absolutely can impact and influence abnormal attachment rate and how the parent takes care of them. Elizabeth?
Yeah, sorry. Yeah, I saw Mariah unmute and then Sandra as well.
Thank you.
I was just going to say, I saw a young mother this morning. She was 21 and her baby is now 18 months old. But at the time of birth, I guess she was in labor for quite some time. The doctor was not attentive, and by the time her epidural wore off, she ended up, being torn. She said they tried to vacuum the baby out. He was premature. That failed 3 times. So the doctor had reached in there and pulled the baby out. So she and the baby both almost died. And she said she couldn't even look at her baby for weeks afterwards, that she just wasn't really resentful, but she had to have an episiotomy, and then she got infection. So she had this feeling that she just didn't want anything to do with the baby because of all the trauma that she had experienced during giving birth. And it was, you
Yeah.
know, her first child. Now they're doing great, you know, and have a wonderful bond. But she said it was really difficult in the beginning.
Yeah. Thank you for sharing that, Chandra. Yeah, I think that's a really good point back to our very first slide, right, about attachment that happens over time and space. And you can see how easily in a situation like that, that abnormal attachment can grow. And so, you know, and part of me, and I mean, definitely that trauma that she was exposed to, and many women experience trauma during labor and delivery. And part of that trauma, but also postpartum depression, you know, postpartum depression can have very similar symptomology of not wanting to be around the baby, not wanting to hear the baby, not wanting to take care of the baby. And so that's a huge factor that can be a contributor. Absolutely. Anybody else?
No, I was just going to comment that I'm really interested. I do Trauma 101, and we touch on that generational trauma. And I just find that to be really interesting, especially if a woman, you know, is pregnant and if she's experiencing trauma, especially ongoing trauma, you know, the cortisol levels in her body and all that, you know. So I think it's very interesting. These new studies are coming out showing how it can be generational and passed down even in the womb.
Yeah, Mariah, I find it super interesting too. And I love reading about it and hearing about it. And I think it's, you know, knowledge is power. I think especially as we're treating a population that has high trauma exposure. And so, you know, it's hard though, because sometimes I know in infant mental health, we have like group supervisions that we can choose to participate in to continue our certification. And you know, some of the things that are stressed and expressed in there, and I can totally relate, is the time frame that you have, right? You only have when a mother comes to see you or has been seeing you. I feel like that I have a short time frame, right, to address all of this intergenerational trauma before this baby is born, to help her with some of these techniques. But the more support you can give, the best. And sometimes it's the very little things. And I think that that's a good reminder to just step back and kind of look at the pieces that we're helping, and having that knowledge about the intergenerational trauma and how we can help in a preventative way. So yeah. Okay, good discussion. Relationships for babies, these are the top things that babies need in relationships, right? Is interaction, touch, and stable relationship. And think about having a baby and not having these three. Like, it's almost impossible. It's almost impossible to not interact or touch them or have a stable and consistent relationship, right? You have to have that. And it's very necessary for babies. It helps provide that safety, security, predictability. This is what they need to grow and to build that attachment. Some of the other needs that they need, of course, is a safe environment. Allowing the safe environment, these interactions can build their self-esteem. Quality childcare is a huge one. And this seems like a no-brainer, right? But it's kind of hard to find quality childcare, and it's hard to find childcare at all nowadays. So sometimes you take what you can get, but a lot of the times in working with some of the parents that I've worked with, they've not really been exposed to quality treatment themselves. And so what we talk about is how to identify those safe people in quality childcare, so that the steps they're making to move forward in a positive attachment will continue as their child's in childcare. And so I like to go over this because I think it's an important piece that we don't think about. And I think it's important to explore that, because it's not necessarily something mothers feel comfortable about talking about either. Like, how do you really pick a child care provider? And so, but it is a really important piece. Reading and
Amanda,
yeah.
How do you define quality childcare?
So we talk about, I think it depends on, there's a lot of different levels. And thank you for asking me, Colleen. And a lot of the times what I talk about with my patients are what type of childcare providers they prefer, because many patients will only will only leave their children with people that they know, right? So only their family members, only relatives. And so we explore like what those healthy relatives will look like, because sometimes some of our patients don't have healthy family relatives or healthy connections. And so we talk about how to identify that within their family system. But then we talk about what their beliefs are and what their parental beliefs are, how they feel their child should be taken care of, what they value the most from being a parent. We kind of explore all of that and help match like a child care provider. That part's kind of tricky because I feel like all the mission statements look the same. So then we talk about, I've walked through, we've talked about ways to walk through and having tours and setting them up and coming back and discussing about that and discussing their tour, what they liked, what they disliked, how important it is to their relationship and their child's relationship. But sometimes this is a long process, but I think it's very important, especially when you're dealing with a parent that doesn't really know how to make these decisions and choices.
Your slide made me think of that terrible experiment that the Germans did when they had all those babies and laid them in cribs or little bitty places and didn't talk to them other than to feed. They fed them, but that was it. No interplay. And I think I remember reading that almost all of those babies grew up with mental health issues.
Absolutely. They did a lot of experiments with the Russian orphanages. And so that's actually where a lot of our infant mental health has developed, was from understanding the orphanages and how those children grew up without any type of healthy attachment and what the outcomes were. And since then, they actually utilized a lot of that information to shut down orphanages and to identify ratios. So they started to identify how many babies to provider ratios. It was also like where some of the research has been pioneered from infant mental health. There's been a couple, I'm drawing a blank on the name because I'm terrible with names, but there was one researcher that really explored in his theory was that you don't come in the nursery without picking up the baby. And so he had everybody picking up the baby, everybody from janitors to dietitians to nurses. You came in the room, you had to pick up a baby or two and just kind of hold them for a little bit. And they did see a decrease in infant mortality, but still attachment issues. As you can imagine, that probably still was not enough interaction. But yeah, that's a very good point, Jackie. It's a very good point. So yeah, reading and communication is another need. We need to increase, that's how you increase verbalizations and literacy, reflecting infants, and play. Play is another way to build attachment, build that relationship, also build their development. And music is amazing. I know, like, it just goes hand in hand with babies and music, right? And I tell everybody, like, I realize everyone knows this, but it's so amazing to see how much music influences kids and their ability to regulate. They really do soothe more with music. I had so I do the Incredible Years with our substance use disorder group, and I had the music therapist that we used to have over at the hospital come over, and she brought all these instruments, and she just turned on, like, so we had them bring all of their kids, they're not all of their kids, but their recent babies to the group. And so we had a room full of babies, anywhere from the ages of like 6 months to 18 months. And they're, like, you can imagine, they're climbing on things, running all over the place, screaming, crying, everything, as we're starting our group. And then she starts playing this music and a couple instruments, and these kids, like, you can naturally see them just like calm down, get close to their caregivers, and start to like move closer to the music therapist. I was like, this is amazing. Like, this is like magic. I should have recorded it. It was pretty amazing. So secure attachments with other caregivers is really important. It's really important for kids to explore those relationships, but they have to have regular interaction. These caregivers have to meet their physical needs as well as their emotional needs in order for them to continue these relationships. I have a caregiver right now that's working on this. It's the biological mom, and then foster mom, or the foster family is in in therapy as well. And so we're all working together towards building this relationship with the 3-year-old. And the foster mom, one of the barriers we had to work to get over is that she had an issue that the 3-year-old just started calling the foster mom. And naturally that's some intergenerational trauma that she's carrying. And as we process through it, she's been able to let it go. But initially she's like, she's not her mother, right? And so what she's learned to identify is that the more relationships this child has, the better off they are. And so we've talked about that, and we've talked about ways that that's going to transition over into her. And so she's accepted that now, but it was really hard at the beginning, and I can imagine that. So Diatic synchrony is really important for attachment. I like to use the metaphor of tennis playing when I talk about dyadic synchrony, because it's like that serve and return. It's the back and forth. It's like you take the ball, throw the ball back to me. You take the ball, throw the ball back to me, right? So this is that back and forth emotions with infants. And if you think about it, it's so hard just watching, right? So babies show all kinds of different emotions. Excited or sad or happy, right? Just watching me, pay attention to yourself. You almost like want to smile or get excited, and that's what we do to babies, right? It's that back and forth, and that's very necessary. That's a necessary interaction. The same with vocalizations. Babies are going to verbalize more and learn more as we vocalize with them. So the babbling, the cooing, all of that is really important. The gaze is important as well. Babies memorize their preferred caregivers by gazing at their faces and identifying exactly who that person is. And that's really important. And it's important for, caregivers to gaze back into their baby's face and sometimes not say anything. But sometimes these pieces, and you can see where preventative methods are really beneficial and can really help. As far as like, I had a mom that I worked with on vocalizations, and when you reflect or paraphrase the vocalizations or what they're saying, right, you're only going to build their vocabulary, right? You're only going to show them that you're so interested in them, and that builds on attachment. That's a huge attachment piece. But I had one mom that could not vocalize back, right? She couldn't do that synchrony of vocalizing. She felt like it was silly and embarrassing and just wouldn't do it even by herself. And so we started off in the office, and she slowly started vocalizing more with the infant, with me present. And then we went to the waiting room, and she would vocalize a little bit more there. But it took a lot of time for her to start to feel comfortable with that. One thing she noticed when she was in the waiting room is other people would do it with her. So then it solicited other people to come over and start like mimicking the baby or participating with her, which reduced her feeling silly. And so we talked about doing that, and she told me how she started doing it at the playground. So I was really excited. That was super successful, but increased their attachment, right? And that child's ability to verbalize things. So I want you guys so what do you think the percent of time are that parents are synchronous with their babies? What would you guess? Like, how much time do you think that parents are synchronous with their babies? So
You can chat it in as well, like I did.
60% of the time. Anybody else? Any other guesses? Anybody want to chat in some guesses? Percent of the time.
Like a dog parent, so moms, dads out there.
Paris says 75% of the time. Good guesses. All right, so it's 50% of the time. I was shocked by this, but if you think about it, babies interact so much, right? That's really all they have to do. They interact with light, they interact with movement, they interact with noises, they interact all the time. And for a parent to have synchrony with them like all of the time, even 75% of the time, like if you think about it, that would be a lot of time, right? Parents are distracted by TV, they're digitally distracted by their phones, they're distracted by laundry, they're distracted by having to make dinner, by other kids. So it's 50% of the time. I was pretty surprised by this, but then when they started providing some of these meanings, I'm like, that makes sense, right? Like we can't really be in synchronous with babies all of the time.
Amanda,
So- Yeah.
I wanted to comment on the gaze thing you were talking about with babies. I think the COVID pandemic and masks has been really interesting. I don't know if they've done any studies on it, but my 7-month-old still looks like confused when he gazes at us when we have our masks on. And I'm just like, he doesn't quite, he's like, I hear this is mom, it seems like mom, but something's wrong. And he just can't quite figure out what's happening.
Yeah, I think you bring up a really good point, Colleen, and that just reminded me amongst my other million things I wanted to do. I'm going to write down those studies because I've been wanting to look up those studies. I looked up a few studies when the pandemic started about the impact of masks and the influence it has on child's development. And I think we talked about this before, but the studies have identified that kids are so adaptable that they're able to adapt to other to eye movement and to other expressions as far as like identifying emotions or what someone's saying or how to respond. But I do see that, and I see it more with and I only know because like I'm looking at the time frame of the DECA that I use. So when I do infant mental health, I use the DECA on a lot, and it goes from like 1 to 6 months and then 6 to 9. And so like the kids that are like 9 months and older, under 9 months, I've noticed the same thing. Some kids look very confused, or they'll look at you, right? I have one little girl, she was 3 months old and she just look at me and stare at me. And she became much more familiar with me because I was actually saying mom for some maternal pieces, but she brought the baby every time and she would just look at me every time. And then she finally got it right. I would pull down my mask and the same thing, like she would recognize me. But after 9 months, those kids are so adaptable. They could read like it was so fast too, like reading my expressions, my eyes. And I'm like, I was just amazed. Like I had one kid that was like, she's 18 months and she reads me so well, and I was like, this is just like amazing. So I definitely want to look up some of those studies because I think it would be super interesting. Yeah, good point. So back to synchrony is really important, right? Because it helps babies regulate and move from one state to another. And so we want to make sure that we're being preventative and helping to build that attachment, because we can see how this can lead to abnormal attachment. And we see a lot of these kids, right? Because the reality is that kids have to co-regulate before they can individually regulate. And if they're not getting this synchrony with a caregiver and having that ability to move from one state to another, they're not going to be able to do it on their own efficiently. And so we have to make sure that that's happening within the dyad. And it's bilateral, right? So these interactions are bilateral, like Colleen was saying earlier, right? So if you have a child that's getting distressed and upset, you know, you're having a parent that's building up and getting distressed and upset. So it becomes a parallel process. It's bilateral. It's going back and forth. They're distressing one another and they're upsetting one another. So you have to stop it somewhere. One has to regulate. And the chances are that it's not going to be the infant, right? We need the parent to regulate. And so it's really important to help with that situation. Help them sometimes identify those cues and signaling so that we can assist in that regulation and build that attachment. I talked with you guys, I think, about this before, but it always comes to mind when I see the look away. The look away is a child's overstimulated, they're agitated, they're annoyed, whatever it might be, but they look away, right, to kind of rejoin and recenter themselves. And many of the times I had a parent, well, she was actually a grandparent, but she would pull the kid's face over and like pull him closer and say, no, look here. And the kid would like look away in distress. And so I work with her to read those cues, because that's how they recenter themselves. That's how they regulate themselves, because it's too much. It's either overstimulating, they're irritated, they're agitated, something's going on. So they need to look away. They can't walk away. So they need to look away for a minute and allow that to happen. And there's other signaling, right? The cries, the squeals, pulling away, pushing away. You'll see babies push their parents' faces away or push away off their chest, or like stiffen themselves up, reducing their speech. A lot of the times you'll see them go from babbling and talking, and when they're distressed or concerned, you'll see them like completely become quiet and just stare. So they reduce their speech. That's them signaling. How can you see this contributing to abnormal attachment? I think I answered it. Anything pop in anybody's mind as we were talking though? No. So what I was talking about, what I had said in the slide earlier was just that if we're not helping assist some of this, it can lead to abnormal attachment, right? So if we're not assisting to the ability to read the cues or talk with parents about this, or understanding their children, or helping them feel comfortable about talking about it, right? Every parent becomes distressed. It's how you handle it that's important. But it can lead to abnormal attachment if it goes unresolved, or if we have some of those intergenerational trauma issues that, like Mariah had brought up. So infant attachment, and this is important, it goes in like kind of a pyramid, right? So it starts at the bottom and just kind of builds up. By 4 to 6 months, you know, that's those routines. They know what to expect from caregivers. They know that in the morning, if they fuss a little, or if they cry or squeal, that they're going to get changed, and then they're going to get fed, and then their day's going to start, right? This is that inner working model. This is the support. This is that comfort and that nurturance that they're starting to feel, so that they can move on. And by 7 to 12 months, they're preferring a caregiver. So they're preferring who they want to be with. Many of the times this is the mom, because the mom's the one that's primarily taking care of them, but not all factors. But this is usually when they start to protest when the other caregiver takes them, or when someone else takes them, or when grandma comes and takes them, right? So this is when they start to protest, because they really prefer a caregiver. And this is important because as they move on from 12 to 18 months, you know, they feel that comfort in their preferred caregiver, and it allows them to build relationships with others, and then move on to explore their world. 12 to 18 months, they're exploring everything, but they still have that secure base that they look back to. They feel comfortable enough to explore out. And if they get distressed, they know that that caregiver is going to be there, right? And this is really important too, because we want kids to be able to explore. We want them to start to develop who they're going to be. If they're exploring, then that means that they can start problem solving, that they can start identifying what it is they like and what they don't like. And a lot of adults that have, you know, kind of, I have a lot of adults that have like an anxious resistant attachment. And it goes back a lot of the times to their inability to identify what it is they like, right? What they don't like. And they're like, I don't even know what I like. I don't know what to do. And when we look back, it really formed from their attachment. And it's pretty amazing to watch that happen. But it's really important to explore that. I always want to just point out that dads matter. Other partners matter as well, but the literature does support that dads have a huge influence and impact, and especially when they're present. When they're sharing the tasks and responsibilities, has a huge impact and influence on infants and their development. There's a lot of literature that supports the tone, the rough and tumble play, and just their physical presence can have a huge impact. A lot of the times I get questions about same-sex couples and how that influences. And there's some literature out there, but really what it goes to is that as long as there's like this male role model, it still has some of the same outcomes. And so the outcomes are that it decreases aggression and increases their academic potential. And so it's pretty amazing that has such an influence on infants, but it's really important to address that. So you can see that developing a secure attachment, right? It's that recognition, it's gazing and identifying those caregivers, having that familiarity that leads these babies to having comfort. Comfort allows them to have pleasure in things, to explore things. When they explore things, they become more resilient, they're able to problem solve, and then they identify what they prefer, what type of people they want to be. And this is just kind of another visual of that similar piece, right? Attachment affects expectations. Our expectations, you know, the child's expectations that they develop affect their internal working model, that comfort, that stability, that consistency. And that's what forms them as people, right? Beliefs, their roles, their relationships. And so attachment is really key from the very beginning. And so you can see a little bit where that abnormal attachment can start. If you think about some of your patients and their history and their backstories, you can start to see and weave in where some of that abnormal attachment could have squeezed its way in there. So Mary Ainsworth identified our 4 patterns of attachment, and we've utilized the strange situation to identify what type of attachment. right? So secure attachment is really important. Anxious avoidant is more of that kind of attachment where they want comfort, but then they're not so sure about it. And the anxious resistant is that they know they want soothed and comforted, but no, don't come near me. And then the disorganized attachment, I feel like, is most of the kids that we work with and I see is they're kind of all over the place. They're completely dysregulated. They don't know how to ask for help. They don't know how to be soothed. They don't like being soothed. They don't like being touched. So sometimes these kids really struggle. We know that disrupted emotional communication is a major impact on abnormal attachment. So you can see within this development how communication can be disrupted, right? How emotional language can be disrupted and how it cannot occur at times. A lot of the times, you know, one of the highest influences on toxic stress on infants is postpartum depression, because you kind of have that flat affect, really no emotional involvement. So this is a huge impact on abnormal attachment. Sometimes you can have parents that send the wrong cues. I have one mom that I'm working with, and she's not alone. I've had a lot of moms actually talk to me about this, but one mom that I'm working with a little 2-year-old, and so he has some disorganized attachment, and what she was identifying was that she has a difficult time co-regulating. She deals with mental health herself, and she has a difficult time co-regulating. And when she was talking about the stress that she was under and managing him, she's like, I didn't know what to do. I was so angry, so I just started laughing. She's like, we were both stressed out. I just started laughing. But imagine the cues that she's sending this child and how disrupted that can be, right? And so then when this child is now this child's learning that when they're distressed, well, I mean, it consistently over time that would happen. She's moving to change that. She's working on regulating her own emotions. But if she wasn't, and this happened consistently over time, that child memorizes those patterns of interaction, and that's how their emotional language is developed. And so then when he's distressed somewhere, he's going to start laughing. Then everybody's going to be like, what are you laughing at? And so we see this all the time with kids, right? And so definitely some mixed cues can contribute to abnormal attachment. We know that abnormal attachment comes from psychological stress. So stressful situations, some of that trauma list that we talked about, and cortisol levels. So Mariah talked about the complete change in cortisol levels, even in utero, when there's intergenerational trauma, and how that can influence a baby's development and their brain development. But even after they're born too, we know, we've talked before about stress levels and how everybody should be exposed to some positive stress. Some are exposed to tolerable stress, and sometimes some are exposed to toxic stress. Toxic stress completely rewires the brain. Constant exposure to toxic stress can shoot high levels of cortisol that can create different brain structure. Even tolerable stress can to an extent, but it shoots different levels of cortisol level, but it's not usually psychologically, it doesn't usually cause psychological damage, but toxic stress will. And adult buffering does not always assist with this, right? And what we mean by that is, we identify that sometimes when you have an abnormal attachment or a disruptive attachment with one adult, another caregiver will come in and kind of buffer through that and try to buffer through it, try to provide some soothing and regulating that mood, but it doesn't always assist with that. A lot of the times kids will learn that pattern of interaction and they'll still have that abnormal attachment with that individual. It doesn't mean that they won't have a healthy attachment, because as long as they have a healthy attachment with one individual, then that can build towards a healthy attachment. But sometimes when you're in a home with two caregivers and one's a really abnormal attachment, it can influence the child significantly. Trauma is a huge issue, right? And so we know, especially in this area, we're serving generations of trauma. And you have kids who are definitely exposed to more than one trauma that we see. But there's all kind of different trauma. We know that early adverse childhood experiences is trauma, domestic violence Domestic violence has a huge impact, and I know I always talk about this, but completely rewires the brain. And I think this is so significant because so much of our population have more than one of these pieces, right? Like I work a lot with substance use disorder, and I know many of you in the PBS program do. And many of the times our individuals with substance use disorder come with more than one of these, right? So a lot of the times when substance use disorder there is involved, then there's domestic violence involved, or a history of physical and sexual abuse, or complex trauma. So we know that this trauma can come across in our population. Disorders in early attachment can predict disruption in attachment and regulation, right? We talked about that. These kids can become less socially competent, have aggressive behaviors, and sometimes later psychopathology. Behaviors of abnormal attachment. We see kids that are emotionally withdrawn. We see kids that just aren't able to relax, right? They seem so stimulated. They're just not able to relax, and they're not able to feel comfortable in social situations, right? They get really uncomfortable and kind of anxious in social situations. We see a lot of negative expectations, some negative Nellies, always thinking the worst, right? Always thinking what is the worst thing that's going to happen, or super dependent individuals, abnormal attachment. These sometimes they're the kids too that if you think about what we talked about earlier, right, and their ability to explore their world, when they don't have that safe caregiver to explore their world and they become distressed, these are the kids that you're seeing on the playground that won't tell anybody they're hurt, won't tell anybody that something's going on, or the complete opposite. They go up to any caregiver, any stranger. They're holding anybody's hand, right? So they display complete dependency on others. They go up to strangers and ask them to open their juice box, or, well, a lot of kids do that though too, but sometimes that can be a sign of abnormal attachment. Kids that are hugging other kids, grabbing their hands, right? And so not really identifying kind of those social cues. Hostility, or just some ambivalence in their relationships. A lot of disorders come from abnormal attachments. So we see a lot of sensory kids when there's abnormal attachment. Anxiety disorders, mood disorders, sleep and eating problems seem to always be present in these kids. Trauma and stress disorders, or relationship disorders. So interventions that we use to help this is CPP, so child parent psychotherapy, is dyadic work. It works completely with the relationship. These are kids who have had at least one trauma, some behavioral problems or PTSD, and this is all dyadic work, working with that relationship and identifying. Attachment and biobehavioral catch-up, so ABC, this is a really popular one too. It's also dyadic work. It works with really nurturing and caregiving and building that synchrony, right? So that serve and return. So it really works on how to build that serve and return and paying attention to the relationship and how to be emotionally available to your child. Parent-child interaction therapy. So this is also dyadic work, working with building that relationship early on, and then introducing compliance training. Parent-child interaction therapy toddler version has a regulation component, which I love. So it builds on the parent identifying and regulating their own emotions before they can come in and kind of help soothe their child's ability to regulate. And then trauma-focused CBT is also another one, right? It works a lot with children towards adolescence. However, it does include the family, and this can be really beneficial in some of that relationship work. And especially later on, when we look at attachment, abnormal attachment, I mean, I think we're getting better at identifying it sooner, but unfortunately, I think it's because we have a sicker population of children. However, sometimes we don't see some abnormal attachment until later on. And sometimes, like going back to my first slide, across time and space, right? You have to continue to build that relationship. A lot of the times as kids become adolescents, parents will back off a little bit, right? They're more independent. They feel like they can give them more freedom, but you still have the work to build that attachment. And so a lot of the times kids can even develop that later on in life. Well, for many of them, they've had that core foundation of attachment, but sometimes when they don't have that core foundation of a healthy attachment and secure attachment, then later on in life, it can be triggered when it comes to adolescence because of parents kind of backing off from that independence. So it's an interesting spectrum. Okay, so this is another intervention that I'm going to show you guys. I utilize this description and this this skill to kind of talk with families about how to be available. So a lot of the times when I'm doing dyadic work, I'll talk with parents about how to be available, but this is the circle of security, and this is an evidence-based group model, and I love this. I've been trying to get this model in West Virginia for 2 years, but I have to tell you, it's ridiculously expensive, and they have super strict rules about like the trainer. Like they don't really like to expand as much. So I'm really working hard though to get that here, because I think it could be super beneficial. So this video is going to depict and explain kind of the shark music that we all face, right? So for those of you who are parents, think about the minute that your kid's screaming or like the super irritated thing that your kid does, right? You can just feel that shark music inside of you, like dun 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 dun, right? You know it's coming, you know, like, oh, this is gonna be a bad day, this is coming, this is where they're going, right? And so you can just feel it building up, and it talks about how it kind of triggers us and how we respond and how it creates that bilateral interaction of dysregulation. And so I'm gonna just play this for you guys because it's really good.
Parents.
Can you guys hear
Throughout
it?
history, we've struggled to get it right.
Yes.
We hope we won't
Okay.
pass on our emotional issues to our kids, and we swear we won't make the same mistakes our parents did. We all have great intentions, but something seems to get in the way. Let's look at what that might be. At Circle of Security Parenting, we believe that being emotionally available to our children and their needs is the key to doing our best as parents. We call emotional availability being with. It means teaching emotional intelligence by being with our children in all their feelings, like sadness, joy, anger, curiosity, pain, frustration, excitement, and so on. Being with children helps them understand, trust, and move on from feelings. And knowing someone is with them in their feelings helps children feel less overwhelmed and more secure. Decades of research backs this up. For parents, some of this comes easily, but other times our children express emotions that make us uncomfortable, so we pull away or try to overrule their feelings, which leaves them on their own. We do this because our children's feelings can trigger strong emotions in us. We think of it like this: our history during childhood of how core people responded to our different emotions creates the background music for how we experience our children's feelings. Let's look at this example. This girl and her father have been enjoying time together in the park, but suddenly aware of the time, Dad says, "We need to go." When the girl hears this, she starts crying and gets increasingly angry. All at once, the dad's background music changes. The background music that is playing for the father right now, we call shark music. As it turns out, the dad's own mother was uncomfortable with loud displays of emotion, and she didn't know how to handle them. So throughout his childhood, she repeatedly told her son it's pathetic to cry, and she never ever asked him about his feelings of sadness or anger. His ability to deal with his daughter's emotion now is greatly affected by the experience with his mother then. Shark music, we're rarely aware it's playing, but it's our past experiences telling us to be afraid of or uncomfortable with a feeling or need that is actually safe. When our shark music limits our ability to respond to these feelings, our children learn to hide or feel ashamed of them. This is a problem because we're teaching our children to fear emotions that are actually both safe and essential in life. Most of us experience shark music with one emotion or another, and it's different for everyone. But whenever it is triggered, our ability to respond to our children's needs is limited. The good news is, by By simply calling it by name and reflecting on what our children need in the moment, we can turn down our sharp music. This is so important because if we can learn to manage our history of negative experiences and perceptions, we can respond to the truth of our child's current situation and be with them in it. Ultimately, this will help our children grow up with a better ability to understand and share more of the emotions they experience. There's no escaping it. Strong feelings are a challenge to manage as parents, but our children always benefit when we have an accurate response to what's happening, rather than reacting to the sharp music we're bringing into the relationship. Remember, there's no such thing as perfect parenting, and blame never helped anyone feel more secure. That includes blaming ourselves. But the more often we can identify our sharp music, the better off our children will be.
So what did you guys think of that? Anybody have any responses from the video?
I think this is something I struggle with at home. And it's kind of hits a nerve whenever you see it presented that way, I suppose. So learning to identify, the shark music is easy enough, but the skills you don't have to teach is where that struggle is. My son, very much more recently, has been slamming doors and hiding under the bed or staying to the side of the room, not wanting to let me come in to be with him. So it's an interesting concept and much to learn, I think.
Yeah. Yeah, Paris, thank you for sharing. Absolutely. I think it's a helpful reminder, and it's interesting to hear it that way and hear your shark music. And I try to be more mindful too, like totally avoided my shark music yesterday and flipped out on my kid, right? It just happens. But it helps you become more mindful of it. And I think it's a great way to explain to parents too. And, if you guys look into the circle of security, it's such an interesting concept that, you remain open to your child's emotions as you're managing your own. And it's like this circle. And so that, when they pull away, you allow them to pull away. And when they come back in, you're available to them. And so it's an interesting concept, but it sounds like it makes complete sense, but like you're saying, Paris, in the moment, it's not so easy to do. So it's really important to not only explain it but to help parents to put it into action, incorporate it. Any other questions, comments, concerns? All right. Well, thank you, everybody.
Great. Thank you so much, Amanda. Really appreciate that. Great video at the end as well. Please, if you have any questions, just reach out to one of us and we'll be happy to answer or follow up on those. So with that said, our only announcement is our next session. It's going to be occurring on April 6th, and Amanda is going to be discussing supporting attachment in kinship and foster care. So that's a really nice segue into that. So I hope everyone has a great rest of your week, and we'll see you soon.
Thanks, Amanda.